Hi, my name is Dr. Pillai. I'm a radiologist and giving you an introduction to the difference between CT and MRI. This is a CAT scanner, also called computed tomography. This is an MRI scanner, also called magnetic resonance imaging. You'll notice that both are shaped like a donut, and you, the patient, lies on a table which has a motor and takes you into the middle of the donut. They look very much alike. A source of much confusion. CT uses X-rays which spin around at high speeds in a tube that circles around you. As you lie on the table and go through. You yourself lay still. The table is motorized. MRI uses very strong magnets. No X-rays. It magnetizes your whole body, although only a portion of your body is inside the little hole. It still magnetizes your whole body, but only takes a picture of a small part at a time. So CT uses X-rays and MRI uses magnets. The X-ray tube spins around. The magnet is stationary. It does not move. CT is very fast and very quiet, often only a few seconds. CT is in cheetah, which is a good way to remember. It's a very fast scan. MRI is much slower, 10 to 30 minutes per body part scanned. If you're getting more than one body part, you can be in there for an hour or an hour and a half or 2 hours, like a snail's pace, but loud, very loud. We give you headphones and you listen to music while you're in there. It's also cold. So CT is X-rays, fast and quiet. MRI has magnets, slow and loud. Both are very expensive, hundreds of dollars per body part scanned. Both sometimes use dye, which is given through a vein, so a technologist may start an IV and inject the dye. The dyes are completely different from each other. The one for CT and the one for MR have nothing to do with each other, chemically or with regards to allergies or in the way they work. MRI has safety issues. Electronic devices will be damaged, credit cards will be wiped, phones will be erased, and it will pull metal towards it. This is a picture of incompatible chair brought into the MRI unit. It drags the chair into it. This is another chair that was dragged accidentally into the MRI region. It picks it up and launches it towards this scanner. This is why we have much screening to make sure MRI safety is followed so no one gets hurt. They will probably ask you to wear a gown because new clothes have copper threads which frequently kill bacteria, but in the MRI scanner they can catch fire. The magnet will cause an electric current in the wire and the clothes. If you have a device inside of you such as a pacemaker or a stimulator for your spine, we need to screen you. The exact device type and name would be helpful, and we will decide if it is MRI safe, which means it's okay to go in, MRI conditional, meaning it's probably okay under certain circumstances, or MRI unsafe, which means it cannot go in. There is no such clearance for CT. Everything can go into CT. There is a different but important information from each type of scan, MRI versus CT, and they complement each other. Depending on your situation, your doctor might choose one or both, or something completely different. So once again, CT uses X-rays, fast and quiet. MRI uses magnets, and slow and loud, and has no electronics of yours allowed inside. The magnet is always on. Unlike a CAT scanner, which the X-ray tube is turned on and off, the MRI magnet is always active. And your doctor will choose which is the best for you. Thank you for your time.